Would you like free audiobooks? Click the link in the description. Question 1. A nurse is assessing a 4-month-old infant during a well-child visit. Which developmental milestone would the nurse expect to observe? A. Sitting without support. B. Rolling from back to front. C. Smiling spontaneously at familiar faces. D. Grasping objects between the fingertips. Answer: C. Smiling spontaneously at familiar faces. Rationale: by 4 months of age, infants typically smile spontaneously, especially at familiar faces, which is an important social developmental milestone. Sitting without support and grasping objects between the fingertips are skills that develop later in infancy. Rolling from back to front usually occurs around 6 months. Question 2. A 2-year-old child is brought to the pediatric clinic for a routine checkup. The nurse notes that the child uses short sentences, follows 2-step instructions, and starts showing interest in playing alongside other children. Which of the following developmental stages is the child demonstrating? A. Sensoromotor. B. Preoperational. C. Concrete operational. D. Formal operational. Answer: B. Preoperational. Rationale: the preoperational stage, according to Piaget, occurs roughly between the ages of 2 and 7 years. Children in this stage engage in symbolic play, begin to use words to represent objects, and start understanding the concept of past and future. The behaviors described are characteristic of the early part of this stage. Question 3. A nurse is educating parents on nutritional needs for their 8-month-old infant. Which recommendation should the nurse include? A. Introduction of whole cow's milk. B. Start iron-fortified cereals if not already begun. C. Exclusive breastfeeding without solid foods. D. The addition of honey to sweeten foods. Answer: B. Start iron-fortified cereals if not already begun. Rationale: iron-fortified cereals are typically introduced around 6 months of age to complement breast milk or formula, providing an additional iron source to meet the infant's growing needs. Whole cow's milk is not recommended until after 12 months of age. Exclusive breastfeeding is recommended for about the first 6 months, and honey should not be given to infants under 1 year of age due to the risk of botulism. Question 4. During a pediatric health screening, a nurse observes a 15-month-old toddler walking independently, using a spoon clumsily, and saying "mama" and "dada" with purpose. Which Erikson stage of psychosocial development is the toddler primarily demonstrating? A. Trust versus mistrust. B. Autonomy versus shame and doubt. C. Initiative versus guilt. D. Industry versus inferiority. Answer: B. Autonomy versus shame and doubt. Rationale: the autonomy versus shame and doubt stage occurs from approximately 18 months to 3 years of age. Toddlers in this stage strive for independence in activities such as walking, feeding, and talking. The behaviors observed in the toddler are indicative of developing autonomy. Question 5. A 5-year-old child is in the clinic for a pre-kindergarten physical examination. The nurse assesses the child's cognitive development by asking the child to count to 10 and draw a person with 3 body parts. These assessments are primarily evaluating the child's progression in which of Piaget's cognitive developmental stages? A. Sensoromotor. B. Preoperational. C. Concrete operational. D. Formal operational. Answer: B. Preoperational. Rationale: the preoperational stage of cognitive development, as described by Piaget, occurs from approximately 2 to 7 years of age. During this stage, children engage in pretend play, develop memory and imagination, and are able to understand the concept of symbols, e.g., numbers for counting. The ability to draw a person with identifiable parts also starts to develop in this stage, although it may be rudimentary. Question 6. A pediatric nurse is planning care for a 3-year-old child diagnosed with autism spectrum disorder, ASD. The nurse includes strategies to manage sensory overload. This approach is best supported by which theoretical framework? A. Erikson stages of psychosocial development. B. Piaget's stages of cognitive development. C. Vygotsky's social development theory. D. Ainsworth's attachment theory. Answer: C. Vygotsky's social development theory. Rationale: Vygotsky's social development theory emphasizes the role of social interaction in the development of cognition. For children with ASD, understanding and managing sensory overload is crucial as it directly affects their ability to interact with their environment and others. Although Vygotsky's theory focuses on social learning and cognition, its emphasis on the socio-cultural context and how children learn to navigate it can be applied to developing strategies for managing sensory issues in ASD. Promoting more effective social interactions and learning opportunities. Question 7. A nurse is teaching a group of parents about anticipatory guidance for toddlers. Which statement by a parent indicates an understanding of the teaching? A. I should expect my toddler to use full sentences by 18 months. B. I'll keep my toddler in a rear-facing car seat until at least age 2. C. It's okay for my toddler to watch TV for a few hours each day. D. Toddlers do not need structured playtime, it's best to let them watch and learn. Answer: B. I'll keep my toddler in a rear-facing car seat until at least age 2. Rationale: the American Academy of Pediatrics recommends that toddlers remain in rear-facing car seats until age 2, or until they reach the maximum height and weight for their seat. This guidance is based on evidence that rear-facing seats better support the head, neck, and spine of infants and toddlers in the event of a crash. The other statements reflect common misconceptions about toddler development and safety. Question 8. A nurse is assessing a 6-year-old child who is visiting the clinic for a yearly physical. The nurse knows that one of the hallmarks of physical development for a child this age is the ability to A. Tie their shoes. B. Ride a 2-wheel bicycle without training wheels. C. Run at adult speed. D. Perform complex gymnastics maneuvers. Answer: A. Tie their shoes. Rationale: around the age of 6, children develop finer motor coordination and are capable of learning to tie their shoes, a task that requires improved fine motor skills, coordination, and patience. Riding a 2-wheel bicycle without training wheels typically comes a little later, and running at adult speed and performing complex gymnastics maneuvers are skills that develop with older age and practice. Question 9. In a discussion about effective parenting styles, a nurse emphasizes the benefits of the authoritative style. This style is characterized by A. High responsiveness and high demandingness. B. High responsiveness and low demandingness. C. Low responsiveness and high demandingness. D. Low responsiveness and low demandingness. Answer: A. High responsiveness and high demandingness. Rationale: authoritative parenting is marked by a balance of high responsiveness, the parent is communicative, nurturing, and attentive to the child's needs, and high demandingness, the parent has clear expectations and rules. Research suggests that children raised with this parenting style are more likely to become independent, self-reliant, socially accepted, academically successful, and well-behaved. Question 10. A 4-year-old child is brought to the emergency department with a barking cough and stridor at rest. The nurse recognizes these symptoms as indicative of which condition? A. Asthma. B. Croup. C. Bronchiolitis. D. Epiglottitis. Answer: B. Croup. Rationale: croup is characterized by a barking cough, stridor, a high-pitched breathing sound, and hoarseness, typically caused by viral infections. It is most common in children 6 months to 3 years old but can affect older children. Asthma, bronchiolitis, and epiglottitis present with different clinical manifestations. Question 11. A pediatric nurse is educating parents about poison prevention in the home. Which statement by a parent indicates a need for further teaching? A. I keep all cleaning supplies in a locked cabinet. B. I've taught my child that medicine is not candy. C. It's safe to store bleach under the sink if it's in a childproof container. D. We have the Poison Control Center's number on our fridge. Answer. C. It's safe to store bleach under the sink if it's in a childproof container. Rationale: even if bleach or any toxic substance is in a childproof container, it should not be stored within reach of children, including under the sink, because children might still find a way to access it. Poison prevention strategies emphasize keeping potentially harmful substances out of sight and reach of children, not just in secure containers. This indicates a misunderstanding of safe storage practices. Question 12. During a home visit, a nurse notices that a 10-month-old infant is not yet able to sit independently without support. The nurse recognizes this as a potential delay in which area of development? A. Cognitive development. B. Social development. C. Physical development. D. Emotional development. Answer. C. Physical development. Rationale: the ability to sit independently without support is a physical or motor developmental milestone, typically achieved by infants around 6 to 8 months of age. A 10-month-old infant who cannot sit independently may be experiencing a delay in physical development. This milestone is crucial for further motor skills development, including crawling and walking. It does not directly indicate cognitive, social, or emotional development delays, although all areas of development are interrelated. Question 13. A school nurse is preparing a presentation on safety for elementary school children. Which topic should be emphasized as a common risk during this developmental stage? A. Stranger danger. B. Water safety and drowning prevention. C. Safe handling of firearms. D. All of the above. Answer. D. All of the above. Rationale: elementary school children are at an age where education about all these safety topics is crucial. Stranger danger addresses the social risks children begin to face as they spend more time outside the home. Water safety is critical as children become more active and may be around pools, lakes, or beaches without constant supervision. Teaching about the safe handling of firearms is also important, especially in environments where children may come into contact with guns. Thus, all of the above topics are relevant and should be emphasized to enhance safety awareness among elementary school children. Question 14. A nurse is assessing the language development of a 12-month-old child during a well-child visit. Which of the following findings would the nurse expect? A. The child uses 2 to 3 word sentences. B. The child responds to simple verbal requests. C. The child babbles in what sounds like sentences. D. The child has a vocabulary of about 50 words. Answer. B. The child responds to simple verbal requests. Rationale: by 12 months of age, many children can respond to simple verbal requests and may understand common words and phrases, even if they are not yet speaking much themselves. Babbling in sentences is more typical of younger infants, while using 2 to 3 word sentences and having a vocabulary of about 50 words are milestones usually reached closer to 24 months. Question 15. A pediatric nurse is providing teaching about fever management to the parents of a 3-year-old child. Which statement by the parents indicates a need for further education? A. We should dress our child lightly if she has a fever. B. It's important to keep our child hydrated when she has a fever. C. We can give aspirin for her fever if she seems really uncomfortable. D. We'll monitor her temperature regularly with a digital thermometer. Answer. C. We can give aspirin for her fever if she seems really uncomfortable. Rationale: aspirin should not be given to children or teenagers with fever due to the risk of Reye's syndrome, a rare but serious condition that can cause swelling in the liver and brain. The recommendation is to use acetaminophen or ibuprofen for fever management in children. Dressing the child lightly, keeping them hydrated, and monitoring their temperature with a digital thermometer are appropriate measures for managing a fever. Question 16. In a discussion about developmental surveillance, a nurse explains the importance of monitoring for signs of autism spectrum disorder, ASD. Which of the following would the nurse include as a red flag for ASD in a toddler? A. Prefers to play alone rather than with other children. B. Cries when separated from a parent. C. Has a tantrum when routines are changed. D. Does not point or gesture by 12 months. Answer. D. Does not point or gesture by 12 months. Rationale: one of the early signs of autism spectrum disorder, ASD, is a delay in or absence of gestural communication, such as pointing or waving bye-bye by 12 months. While preferences for solitary play can be a sign of ASD in older children, it is not uncommon for younger children to play alone. Crying upon separation from a parent is a normal stage of development known as separation anxiety, and tantrums in response to routine changes are also common in toddlerhood. However, the absence of pointing or gesturing by 12 months is a specific red flag for ASD. Question 17. A nurse is providing education to a group of new parents about sudden infant death syndrome, SIDS. Which of the following should be included as a recommendation to reduce the risk of SIDS? A. Place the infant to sleep on a soft mattress with plenty of pillows. B. Ensure the infant sleeps in a prone position. C. Share a bed with the infant to improve parental bonding. D. Use a firm sleep surface and avoid placing loose bedding in the sleeping area. Answer. D. Use a firm sleep surface and avoid placing loose bedding in the sleeping area. Rationale: to reduce the risk of SIDS, parents are advised to use a firm sleep surface, such as a mattress in a safety-approved crib, covered by a fitted sheet. It's also recommended to keep the sleeping area free of loose bedding, pillows, and soft toys that could increase the risk of suffocation. Infants should be placed to sleep on their backs, supine position, not on their stomachs, prone, or sides. Sharing a bed with an infant is discouraged due to the increased risk of suffocation and SIDS. Question 18. A pediatric nurse is assessing a 7-year-old child during a routine visit and notes that the child is able to ride a bicycle with training wheels, tie their shoes, and uses scissors to cut simple shapes. These skills are indicative of which of the following developmental milestones? A. Gross motor skills. B. Fine motor skills. C. Cognitive skills. D. Social skills. Answer. B. Fine motor skills. Rationale: the ability to tie shoes and use scissors to cut shapes are indicative of fine motor skill development. Riding a bicycle, even with training wheels, also involves fine motor coordination for steering and balancing, in addition to gross motor skills for pedaling. Fine motor skills involve the coordination of small muscles and movements, usually involving the synchronization of hands and fingers, with the eyes. Cognitive skills refer to the mental capabilities for processing information, and social skills involve interacting with others. The skills described primarily highlight the child's advancement in fine motor development. Question 19. During a community health fair, a nurse is providing information about accident prevention in children. The nurse emphasizes the importance of supervising young children during bath time to prevent which of the following? A. Drowning. B. Burns. C. Poisoning. D. falls. Answer: A. Drowning. Rationale: supervision during bath time is critical to prevent drowning, as young children can drown in just a few inches of water and within seconds. This makes it one of the leading causes of accidental death in infants and toddlers. Burns would relate to ensuring the water temperature is not too hot. Poisoning concerns might involve the ingestion of hazardous substances often found in bathrooms, and falls could occur getting in or out of the tub. However, the direct context of supervision during bath time is primarily aimed at preventing drowning. Question 20. A nurse is discussing developmental milestones with the parents of a 9-month-old infant. Which of the following would the nurse identify as an expected developmental achievement for this age? A. Walking independently. B. Saying mama and dada with specific intent. C. Pincer grasp development. D. Building a tower of 4 blocks. Answer: C. Pincer grasp development. Rationale: by 9 months of age, infants typically develop a pincer grasp, which is the ability to pick up small objects using the thumb and one finger. This skill is crucial for feeding themselves finger foods and plays a significant role in their fine motor development. Saying mama and dada with specific intent and walking independently are milestones that are commonly achieved a little later, closer to 12 months for the speech milestone and anywhere from 9 to 18 months for walking. Building a tower of 4 blocks is usually seen around 18 months of age as it requires more advanced motor skills and coordination. Question 21. A pediatric nurse is conducting a health education session for adolescents on skin care. The nurse emphasizes the importance of sun protection to prevent A. Acne. B. Atopic dermatitis. C. Skin cancer. D. Psoriasis. Answer: C. Skin cancer. Rationale: while good skin care practices can help manage conditions like acne, atopic dermatitis, and psoriasis, the emphasis on sun protection is particularly important to reduce the risk of skin cancer. Ultraviolet (UV) radiation from the sun is a major cause of skin cancer, including melanoma, which is why wearing sunscreen, seeking shade, and wearing protective clothing are crucial preventative measures. Question 22. In a pediatric clinic, a nurse is assessing a child's readiness for toilet training. Which of the following signs indicates that the child may be ready to begin toilet training? A. The child is able to stay dry for at least 2 hours at a time. B. The child has just learned to walk. C. The child dislikes wearing diapers. D. The child is able to remove their own diaper. Answer: A. The child is able to stay dry for at least 2 hours at a time. Rationale: one of the signs that a child may be ready for toilet training is the ability to stay dry for at least 2 hours at a time. This indicates that the child's bladder muscles are developed enough to hold urine for a prolonged period, which is crucial for successful toilet training. While disliking diapers and being able to remove them may show a readiness for independence in toileting, these are not as strong indicators as physiological readiness. Learning to walk is a significant milestone but does not directly correlate with bladder control and readiness for toilet training. Question 23. A nurse is teaching a group of new parents about infant feeding practices. Which statement by a parent would indicate a correct understanding of introducing solid foods to their infant? A. I should start to introduce solid foods at 2 months to ensure proper growth. B. It's best to introduce new foods one at a time over a few days to watch for allergies. C. Solid foods will replace breast milk or formula in my baby's diet by 6 months. D. I can add salt and sugar to my baby's food to make it taste better for them. Answer: B. It's best to introduce new foods one at a time over a few days to watch for allergies. Rationale: the correct practice for introducing solid foods is to introduce them one at a time and wait several days before introducing another new food. This approach allows parents to monitor for any allergic reactions. Introducing solid foods is recommended to start around 6 months of age, not 2 months, and solid foods complement breast milk or formula, rather than replace them, during the first year of life. Adding salt or sugar to an infant's diet is not recommended due to the potential for harm and the importance of establishing healthy eating habits early. Question 24. During a well-child visit for a 6-year-old, a nurse is evaluating the child's cognitive development according to Piaget's theory. Which activity would the nurse expect a child of this age to be able to perform? A. Think abstractly about concepts. B. Understand the concept of conservation. C. Engage in complex problem-solving tasks. D. Classify objects based on multiple criteria. Answer: B. Understand the concept of conservation. Rationale: according to Piaget's stages of cognitive development, a 6-year-old is in the concrete operational stage, which typically begins around age 7 but can start showing signs earlier. Children in this stage begin to understand the concept of conservation, the idea that quantity does not change, despite changes in the shape or arrangement of objects. Abstract thinking, complex problem solving, and the ability to classify objects based on multiple criteria develop in later stages of cognitive development. Question 25. A pediatric nurse is discussing the importance of physical activity with the parents of an 8-year-old child. The nurse emphasizes that regular physical activity in children can help prevent A. Type 1 diabetes, B. Myopia, C. Obesity, D. Type A personality. Answer: C. Obesity. Rationale: regular physical activity in children is crucial for maintaining a healthy weight, improving cardiovascular health, and building strong bones and muscles. While physical activity has many health benefits, its role in preventing obesity is particularly significant given the global increase in childhood obesity rates. Physical activity helps to balance calories consumed with calories burned, which can prevent obesity. Type 1 diabetes is not directly preventable through physical activity as it is primarily an autoimmune condition. Myopia, nearsightedness, has been linked to outdoor activity, but physical activity's role is more about outdoor light exposure than the exercise itself. Type A personality is a temperament characterized by high levels of competitiveness and urgency, and it is not something that physical activity can prevent. Visit nursestudy.net for more nursing practice exams, care plans, and study guides.